there, this is Dr. Dane Donahue, and I'm going to go over the core strength testing for the wellness score. The core strength parameter in your wellness score is made up of 4 core strength tests, and this is how we do it in our office. We use this parameter, I think is a great parameter to show people their core strength to see if they have stability. We look for 2 things. We look for mobility with our core flexibility parameter, and we look for stability, core strength, with our core strength parameter. It's made up of 4 tests. The max score you can get is a 4 if you pass all 4 tests, and obviously for each test that they fail, they lose points for that. So the first test that we normally do is a lunge test, and I like to use PVC, especially if the patient has a hard time. We're just going to have them do a forward lunge, and I'll do it from the front and the side, and they will come all the way down, touch the knee, and come up, back up again. So you're looking for a nice transition, nice slow glide, tap the knee, not to crash down. If they crash down or they have to push to get up, that would be a fail. If they obviously can't get with a full erect spine all the way down and all the way back up again, that would be a fail as well. So let me show it to you from the side. What we're looking for is that they need to hold on, great. If they don't need to hold on, that's even better. Hands on the hips. They're going to bend down, touch, come back up again. Opposite leg, bend, touch, come back up again. And that would be what you're looking for. The next test we're going to do is more of a core strength and a core balance test. We're going to have them hold the PVC out. We're going to have them lift to 90 degrees of hip flexion and hold for at least 5 seconds, more like 10 seconds. We're looking for good stability in the core. Okay? A pass would be somebody does this. They can't hold it for 5 seconds. They're shaking, right? But we're obviously going to test both sides. Lift to 90 degrees of hip flexion and hold. Okay? So that's our second core strength test. Now we're going to do a couple of tests on the table. We're going to do an upper and a lower core strength test. The first test we're going to do is simply a sit-up. So we're going to do from a recumbent position, the feet on the legs. We're going to see if the patient can just sit up to a seated position. Okay? So lie down. They can't do this, right? They can't use any momentum. They can't lift their legs at all when they're doing it. So we're looking for just a nice transition from a nice supine position to a seated position. That would be a pass. The next test is more of a lower core strength test. We're going to have them lift their legs to 90 degrees, full recumbent, right, supine. They're going to lift their legs about 6 inches off the table and hold that for about 10 seconds. And what we're looking for here is can they do it, number 1, and then can they do it without pain. Okay? So if they have pain when they're doing that, and a lot of people who have facet syndrome, or any type of disc problem will have pain when you ask them to hold because of the compression that creates in the lumbar spine. So those are our 4 core strength tests, and just to review them, we started off with the lunge test bilaterally, then we went to the 90 degrees of hip flexions on one leg, hold that for 5 or 10 seconds, look for core stability. Then we did an upper core strength test of just sit up from supine, and then we did a 6-inch leg lift and hold, and we're looking for any type of pain on any of those core strength tests is automatic fail. And then obviously if they can't do the test, that's a fail as well. Then you enter the parameter, that score, into your core strength test, and that's how you get your core strength parameter. Thank you.